Hey guys, should I say cry with me? Should I call this video cry with me video? I don't know what to call this video, guys. I am in a lot of pain. Like my goodness. I'm in so much pain. I mean, like this is a week after and I'm in pain, guys. No, it's not heartbreak. I'm not heartbroken. Thank God. I don't let myself be heartbroken anymore. So it's not pain in my heart. I'm just in pain, guys. So let me tell you what happened. Because I'm sure you're wondering, is this the same Betty we know, all bubbly and happy? I feel like my whole mouth is burning. Guys, so a week ago, I went to the dentist and they pulled I had my wisdom teeth, all my wisdom teeth extracted. I mean, not all. I don't know how many we have, but I had four. One, two, one, two. I had my wisdom teeth extracted. Four teeth. And that day, guys, let me tell you one thing. I did not know that after extraction, my mouth will feel so swollen. So anyway, because of obviously because of numbness, um, because of this that anesthesia, poking and everything. So my mouth was numb, and after the surgery, I went ahead to do my errands because I had to do a few things. Although my mouth was very uncomfortable and bleeding. And guess what, guys? Oh my God! After after the numb, after after that numbness went away, I went back to myself and I was in pain. Like, let me tell you, I've never experienced so much pain in my whole entire, because that time I was not even on pain medicine. I have never experienced so much pain than I experienced that day. I was screaming like, guy, I almost peed myself. Anyway, I had to do a few things out there, then come back in the house. I took some pain medicine and the pain went away. Pain went away. I took 1200 milligram of ibuprofen. It was that bad. I took two 600 milligram ibuprofen right away on the spot. I was hurting so bad. The only pain that I've ever experienced like that was childbirth. Hmm? Anyway, don't mess with teeth, guys. I think the reason why it hurts so bad because of the nervous system is up here. Yeah. Anyway, let me tell you, it's been a week. It's been a couple of days, and I'm still in pain. 2 days ago, I started experiencing some really agonizing pain, like really bad. And when they take out when they extract your wisdom teeth, they tell you don't drink from a straw, don't sneeze, don't cough, don't smoke. I haven't done that. Eat soft food. I'm eating soft food. I don't know what to eat. I'm hungry most of the time because I'm like, oh God, I don't know what soft to eat. But anyway, guys, at this point, it's supposed to get better. So they tell you eat soft food, don't smoke, don't do this, don't use a straw, and because you don't want to get the dry sockets. Guys, let me tell you, I have stitches. Even uh when I do this, I think my face is swollen. When I do this, I feel my stitches. And one of the stitches is really making me uncomfortable. I don't want to show you. But I have stitches. And I thought with the stitches, I'm not going to get dry socket. Now I have dry socket. If you don't know what dry socket is, you can look it up. You'll see videos about socket. Dry socket is when they remove the teeth, and then instead of the blood, I think that the blood, the blood is supposed to clot over there, and then when that blood clot comes out and the bone is exposed and the nerves is exposed, that's a dry socket. Very painful. Whoa, guys. I'm not exaggerating. It's very painful. My teeth, the rest of my teeth are hurting so bad. Like, I just feel pain from corner to, I don't even know. I can't even explain where the pain is. I took ibuprofen again few minutes, like an hour ago. I was laying down here and I thought, let me do this video to keep you up to speed what's going on. And I'm telling you guys, I wish I never had those wisdom teeth removed. My appointment was 4 days after coming back from Mexico. Imagine, after coming from Cancun, I had my appointment to do my teeth. Man, that was the welcome package, yeah? Man, I'm telling you. Removing the teeth, my experience, I don't like the experience because, you know how they poke you, giving you the anesthesia? They poke you, and when they give you those injections, it's very painful. But that's not even the bad part. I think the bad part is if you get the dry socket. I'm thinking I have infection because I'm starting to feel some sort of I don't feel like bad taste per se, but I don't know. I'm feeling some throbbing. Some throbbing, it's like the rest of my teeth, everything. If you're a dentist or you work in a dental field, you know what I'm talking about. It's just like electricity from one end to the other. Man, guys, I don't even know whether it's this the top or the bottom or the top or I just know. Guys, I wish I can open my mouth and show you, but it's ugly. I don't want to show you. I don't want to disgust any one of you. I don't want you guys to throw up. It's ugly, and with all the stitches. Anyway, I called today because dry socket is considered an emergency. I called today, and they told me they're gonna take me in. The doctor can see what's going on in there. So I don't know for sure what's going on, but I just hope they're gonna take the pain away, because what really shocking is, no matter how much pain medicine I'm taking, it still hurts. The pain is not stopping. Is that supposed to happen a week after? Is it even a week? This is more than a week after. Is this supposed to happen? Am I supposed to still experience so much pain? Almost 2 weeks now? I know. There's no way. And also it's giving me some sort of headache. Guys, thank God. Sometime I'm like, thank God, I stay home. I'm a stay-home mom. If I had a regular job, I would have called off, But at least today, I had an appointment for one of my kids, but I had to cancel it because I'm like, I have to take care of this. It's up, yeah? Guys, it's not funny. Ooh, my bottom teeth. Anyway, I shared a story of how I had my implant done, and I had it done for free. By the I was part of the study, so I had it done for free, but I got to pay the crown. For the crown, I'll pay $1,500 to get the crown, to get the teeth. This is for this one. Yeah. So I had implant already. They did an implant already for free. So now, very, very soon, so after I heal all this, I'm going back in to get deep cleaning, because I have infection. Two of my teeth, they have infection. So I'm going for deep cleaning. So I'm gonna I never have teeth problems, but it seems like this is my time to have I've really enjoyed a long time with no teeth issue. And even for my wisdom teeth, I was not to have it removed. I just when I went to the dentist, they took x-ray to do my implant. The dentist advised me, they say, have your wisdom teeth removed, because they are getting out of shape. You don't need them anymore, and the shape they are taking, and plus one of them doesn't look very good. They don't look very good, and the doctor was like, there's barely no room for your wisdom teeth for your teeth. Like, your teeth are so piled up in there. So they advised to have them removed so that I can have some space in my mouth. And that's how I ended up here. Of course, I wasn't signing up for pain. I just knew I'm doing the right thing for myself. Even now, I have faith that after after all this is gone, I'm gonna be okay. I'm gonna be okay. Let me tell you, dental in America, dental care with no insurance, it can be very expensive. Very, very expensive. And the reason why I'm saying I had my implant done for free is because you guys, I don't know what I can tell you, but with insurance, it's still expensive. Even I think the whole price of getting an implant is about $7,000. Yeah. So if you have insurance can cover like $3,000 or $4,000, and then you pay the rest. Yes, it's very expensive. Getting an implant is very expensive. So I took advantage of that. Being part of the study, it means like for example, if a dermatologist is working on a cream and Betty want to be part of the study and participate in using their cream for them to test with Betty's face, but just being part of, anyway, that's not it. What it means is these students have graduated. They have already become doctors. They are doctors already, and they're practicing. And before they go on their own, they kind of have to do one more, few more practice. So you let them practice with you, and they don't charge you. And they do a good job. Guys, I can tell you my implant was so, everything went so good. So fresh. Everything went so good, like so quick. It healed so fast. Yeah, they do a good job. So for my extraction, that wasn't part of the study, because somebody can come after me and say, Betty, why are you going for these cheap things? They are not cheap. These are doctors we are talking about here. It's just affordable. This clinic is affordable. To get extracted one tooth is $100. And then they draw blood. This blood, I don't know what they make with the blood, but whatever they make is supposed to fill in, like a bone. They draw your blood and they put the blood, the top layer in your bone, in your wound, and it just helps to heal faster. So that's what happens. Even that cost me $50. So In total, to have 4 teeth and the blood draw and everything, I paid $470. If I go to like a regular dentist, they will charge me more. So this one is more of affordable, like affordable dental place. Yeah. Um. Also, I'm going for deep cleaning. Deep cleaning, I'll be paying 250 for deep cleaning. Let me tell you guys, dental work in America is very expensive. I don't have dental insurance. I don't have vision insurance. I only have medical insurance, and um, let me tell you, it's not cheap. Dental. Vision is okay. I can pay for my glasses, but and glasses is once a year. What? Yeah. I don't have a lot of complication. I pay like $500 a year for glasses, but for dental, wow. Let me tell you, a lot of people, they advise to go to Mexico or go to Kenya. I mean, go to Africa to have their teeth done. Let me tell you guys, I'll go to Asia. For me, I feel like you should get your teeth done in a country where you have a lot of time to go back and forth to the dentist. I'm not saying going to Africa or Asia or Mexico is bad, but can you imagine right now, if I had my teeth done when I was in Mexico, and then I come here and I have issues, complication, am I going to take a ticket back to Mexico? No. So I'm so glad that I had my teeth done here in the US. Even, imagine, somebody was telling me, oh, have implant done in Kenya. It's not cheap too. Implant in Kenya is not cheap, and it's not one step. If you know what I'm talking about, implant is not just, implant is not bridges, it's expensive too. So when you look at the cost, it's the same, because here, if I'm only having to pay for the crown $1,500, so that means it's all the same as paying it in Africa, or Mexico. So it's better to have it done where you are in case of complication, because the doctors here, they are very strict. If you come back with complications from a surgery that was not done by them, most of the high chances they won't take it. They don't want to deal with that, yeah? And so, yeah, if you're doing it out of the country, make sure you have time. Make sure you have time for it to heal when you're there. Visit, go back for your post-op appointment. Yeah. Anyway, guys, I don't want to make the video long, and I just want to end it there. Just pray for me. Pray it's not infections, and whatever it is causing so much pain, pray that the doctor will find out what it is and they'll give you medication for it, and everything will be fine. I want to do videos when I'm happy and bubbly, and not like this. Guys, I need ice packs. I think I'm swollen. Take care, guys. Bye.